Chief Medical Officer Dr. Sharon Delma-George reminds the population that the ban on public mass crowd activities is still in effect. Recently, video and images emerged of a sea of humanity at Pigeon Point Beach. Furthermore, there have been reports of birthday bashes, beach picnics, and socializing at venues where in some instances people are not donning masks and practicing physical distancing. The public health official warns that despite weathering the recent severe third wave of the pandemic, this is no time to throw caution to the wind.
We remind the public that although we note the flattening of this third wave, we still have over 100 active cases. We would like to alert the public that mass crowd activities and open socialization is not recommended nor approved at this time in our management of the pandemic. We continue to receive numerous reports of widespread socialization across the island. We are still at high risk at this point in time. The public health team is working to reduce the number of active cases to less than 50 to enable the safe opening of more activities. We ask the public to work with us and continue to be patient. The premature social activity will lead to an upsurge of cases given the exponential transmission typical of this virus.
The post-Christmas holiday spike in cases resulted in thousands of infections, which set back progress made by the island in the marathon slog with the very contagious virus. A state of emergency, curfew, and other measures had to be reinstated to beat back the wave of cases.
St. Lucia has recorded a total of 4,161 cases to date and managed 3 epidemiological waves with a total of 58 COVID-19 related deaths. At present, we have noted a total of 3,977 recoveries. During the month of March, we note the steady decline in the number of cases, in the number of persons accessing care at the respiratory clinics, and the reduction in the number of admissions at the respiratory hospital. We applaud the public for their cooperation during the last few difficult months of managing this third and intense wave in country. The Ministry of Health is encouraged with the progress noted thus far in managing the third wave, and with the rollout of the COVID-19 vaccine, is hopeful for quality of life improvements in relation to COVID-19 in the near future.
But the island, the CMO warns, is not there yet. While acknowledging the toll of pandemic fatigue, Dr. George recommends that citizens stay the course, as the health threat is far from over.
We understand and acknowledge the level of frustration that the public has had to endure by the many protocols and lockdowns in the past year. These measures have been implemented in an effort to reduce the impact of the virus on our vulnerable population. As we reduce the cases and the risk, we have been reducing the strict measures in a controlled manner. At this point, we remind the public that although we note the flattening of this third wave, we still have over 100 active cases.
Last week, the CMO sought to tame the impulses of some misinformed and over-exuberant citizens who thought it would be a good idea to keep their mask at home after receiving just one jab of the COVID-19 vaccine. This is not only unwise, but dangerous and deadly. Public health officials explained that 2 shots of the vaccine are required, and well over 70% of the population needs to be fully immunized before the nation can even start turning the corner in the pandemic crisis. Until then, citizens of St. Lucia are advised to don your face mask, wash your hands, and keep your distance. Winston Springer Jr., HTS News Force.